back to the East Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, share, and subscribe. And please do come back for more.
Hey
See you
everyone,
soon.
and welcome to today's Explainer. If you've ever winced while tying your shoes, struggled to get up out of a chair, or if you're kind of slouching while taking this in right now, well, you are absolutely in the right place. Today we're diving straight into the clinical realities and, more importantly, the practical solutions for back pain. We're drawing all of this from a really comprehensive guide by Dace Medical Consulting. We're going to break down exactly why your back hurts, how to actually fix it, and when you seriously need to worry. Let's just jump right in. So think about this. A staggering 84% of adults are going to experience back pain at least once in their lifetime. Compare that to just 16% who somehow manage to escape it entirely. If you are struggling with a sore back right now, these numbers prove that you are absolutely not alone. It's practically a universal human experience. But here is where it goes from being just a common annoyance to a true global health epidemic. 23%. That is the percentage of adults who suffer from long-term chronic back pain. In fact, our source material highlights that back pain is the #1 leading cause of disability worldwide. It fundamentally alters how millions of people live their everyday lives. Which brings us to Section 1, understanding the root causes. Literally, why does it hurt? Well, for the vast majority of us, cases fall under what doctors call mechanical back pain. Basically, this means the pain is linked to how your muscles, your ligaments, and your joints move together with your spine. It's essentially a wear and tear issue of your everyday tissues, not some severe, scary underlying illness. Let's break down the 3 main culprits of this mechanical pain. First, we've got muscle strains or sprains, which are usually triggered by, heavy lifting or sudden awkward twisting. Then, there are disc problems. This is when the little cushions between your spinal bones bulge out and press on nerves, causing that sharp, shooting pain like sciatica. And finally, there are age-related changes, where normal aging damages the small joints in the spine, very much like arthritis. That's what's physically happening inside there. So you've got to ask yourself an important question. Are your daily habits actively hurting your spine? Just take a quick mental inventory of your day before we go over the most common risk factors. Okay, here are the things that make you most vulnerable. Long-term sitting at a desk, carrying extra weight, and just getting older. Those are the usual suspects. But look at smoking on this list. It's not just bad for your lungs. Tobacco actually reduces the blood and oxygen supply to your spine, which speeds up damage and slows down your recovery. And definitely don't overlook psychological factors. Stress, anxiety, and depression can keep those back muscles completely tense and contracted for hours on end. All right, moving on to Section 2, when to see a doctor. We're talking diagnosis and red flags. If you're sitting there worried that you need an immediate, super expensive MRI, let me reassure you. Diagnosis is primarily based on your medical history and a careful physical exam. Doctors are really just looking at your reflexes, your muscle strength, and your mobility first. Scans like X-rays or MRIs are generally only needed if your pain persists for more than 6 solid weeks, or if there are specific warning signs present. So what exactly are those warning signs? Let's definitively contrast them. On one hand, you have normal, albeit very painful, mechanical symptoms, sciatica, muscle spasms, and morning stiffness. But then you have your emergency red flags. If you ever experience numbness in your groin, any loss of bowel or bladder control, a fever alongside your back pain, or sudden unexplained weight loss, those mean you need immediate emergency medical attention. No waiting around. Let's get to the good news. Section 3, pathways to lasting relief. We'll look at both medical and home treatments. Your absolute first line of treatment is usually physical therapy. The entire focus here is on giving you your independence and functional mobility back. Therapists use graded activity programs, core muscle strengthening, posture training, and vital education on safe lifting strategies to essentially rebuild your spine's entire support system. Now, if physical therapy isn't quite enough, there is an escalating scale of medical interventions. It starts with medications, like NSAIDs for immediate relief. Then it might move to image-guided injections into the epidural space or nerve root. And finally, surgery. But it's important to note that surgery, things like spinal fusion or decompression, is strictly reserved for extreme cases where all other conservative management has completely failed. But what about right now, today? Here are some actionable steps you can take at home for immediate relief. Step 1 is honestly a bit counterintuitive. keep moving. Sitting still all day actually worsens back pain. Slow, gentle movement keeps your spine functional. Step 2, use heat to relax those tight muscles. And step 3, find a comfortable resting position, maybe using pillows under your knees or a small cushion for lumbar support. Which brings us to our final part, Section 4, preventing future back pain through lifestyle changes. These are your core, everyday preventative strategies. First, fix your ergonomics. If you work at a desk, keep that screen right at eye level and make sure your arms are resting comfortably. Second, engage in regular, whole-body exercise. Third, maintain a healthy weight to take some of that physical stress off your spine. And fourth, as we learned earlier, quit smoking to keep that crucial oxygen flowing to your joints. I really want to highlight this specific quote from the source material. The more you move, the more nutrients get into your spine. That beautifully, simply summarizes why activities like walking, swimming, and yoga are so absolutely vital. Motion literally feeds your spinal discs and keeps them healthy. And that leaves us with this final thought. We've seen the data, we understand the mechanics, and we know the treatments. So what is the one lifestyle change you're going to make today for your spine? Are you going to adjust your monitor? Maybe go for a brief walk? Your back supports you every single day. I think it's about time we support it back. Thanks so much for joining this explainer, and we'll catch you next time.
Please subscribe.